the conversation. Tell me what you think about the issues of the world. What kind of spice you wanna be? Tell me where you wanna travel. Do you believe in luxury? What's your hidden passion? What makes you so unique? Conversations with Nicole. Conversations with Nicole.
Greetings, I am Nicole Everett and this is Conversations with Nicole, and today our very special guest is Dr. Andrea Friall, the Chief Medical Officer at Tallahassee Memorial Healthcare. Welcome, Dr. Freyal.
Thanks for having me.
So Dr. Freyal, you've been with Tallahassee Memorial Healthcare for how long?
Well, officially in this role, I started in November of 2016.
Okay.
I came into this community back in 2001 and started out as an OBGYN with North Florida Women's Care, and continued to serve the community through that practice and had opportunities through the leadership track through TMH, and this is where I ended up.
Fabulous. So as Chief Medical Officer, tell me what that entails.
Well, that involves the management of the medical staff, and when we talk about the medical staff, that's the privilege of all the physicians and practitioners that work within the hospital unit. And as a Chief Medical Officer, I make sure that all their credentials are up to date, and that we try and make sure that we are doing the best practices for the community.
So, Dr. Freyal, TMH has a new wing or a new surgical center that's being built. Can you tell us more about that?
Absolutely. We're very excited about the new MT Muschen Surgical Center. It is going to be a multi-story facility boasting over 340,000 square feet.
Wow.
Yes, it will have 28 state-of-the-art operating rooms,
Oh, wow.
as well as an addition of 72 new surgical intensive care and medical beds to help care for patients. All of the rooms will be private, and so that's very exciting for
That's a big deal.
Yes, and even better, we'll have parking.
Yes, we could
that
use
in
more
there. We
parking
could always
here.
use parking.
Yes.
It's always but and we're just very excited about this addition for our physicians and practitioners to be able to serve the community in the state-of-the-art facility.
Great. So what's the estimated time of completion?
We should be finishing up and ready to at the end of 2018, but we are hoping to do our first case in the spring of 2019.
Oh, wow.
So we should be open for business and helping patients in spring of 2019.
That's exciting. So TMH is more than just a hospital, right?
Absolutely. The TMH as a whole has the opportunity to reach out to the community. So we participate in activities to help bring our community to be the healthiest in the nation. That's our goal and our vision for the community. So through activities such as TMH for Life and other activities within the community, we help to provide opportunities for the community to engage in healthy activities, baby fairs, health fairs, things that keep us moving.
So a lot of preventative type activities in the community.
Absolutely, and even most of that information is sort of at your fingertips. If you were to go to tmh.org and you're feeling like you wanted to do something to help benefit your health, whether it's diet advice, health fairs, things that are available in the community, you can always go to tmh.org and it will be on the website for you.
That's excellent.
So that's one way we're able to reach out to the community.
I hear that TMH has the most spectacular stroke center. Tell me more about that.
Well, we are very proud to be the most comprehensive certified stroke center in the Panhandle area, and to have this opportunity to serve our patients in this area with the ability to actually do surgery without having to open the skull, and that's significant for these stroke patients.
Wow.
For brain and spinal cord surgery. So we boast some very exciting physicians that are able to use this technology and their advanced skills to take care of our stroke patients.
Excellent. So hopefully we'll catch strokes in advance, maybe?
Absolutely, and that comes from education too. That's part of our overall goal and vision for the community. Right. So the more education that we do and getting out in the community about risk factors for stroke, that does help minimize the times that the surgeons will have to go in and perform their magic. We also boast one of the most dynamic and comprehensive heart and vascular programs in the Panhandle and the northwest side of the state.
So you also have a trauma center that's pretty recognized as well.
Yeah, we are the only trauma center in this area,
Okay.
so we TMH keeps very busy with that aspect. You know, as we serve our community and continue to grow, that program will also continue to grow. We're the only level 2 trauma center in this area.
Wow. So I bet you all stay pretty busy.
All day and all night.
You're not speaking from experience, are
Oh
you?
no, I wear these scripts all the time. But you always seem to catch up with me, Nicole.
You know, we have a way of doing that.
Yes, you do. It's my pleasure.
All right. Well, we're going to take a little break right here, so you all stay tuned for more conversations. This portion of Conversations with Nicole is sponsored by Tallahassee Memorial Healthcare. Welcome back to Conversations with Nicole. If you're just joining us, today we have Dr. Andrea Friall of the Tallahassee Memorial Healthcare. And earlier we were talking about some of the services that TMH offers. Now I know that there's an awesome cancer center. Tell us a little more about that.
Sure, we boast one of the longest running accredited community programs for cancer and for the community hospital-based programs, and we are so excited that we continue to recruit new physicians and practitioners for the care of our patients that allow us to provide state-of-the-art cancer care right here in Tallahassee without patients having to travel as they had to in the past.
That's huge.
It's huge. We have a wonderful new healing facility, and the cancer center is freestanding with, and it's a beautiful place for healing.
I heard it looks more like a spa.
Well, I think the patients deserve that.
Indeed.
And so, you know, it's a very exciting time to not have to necessarily travel to be able to get your cancer care. We're very excited about trying to have an all-inclusive area for cancer care here.
That's excellent. So let's move on to your favorite topic. Since you are
Babies.
OBGYN, right?
I am.
So tell me what's going on in the OBGYN world.
Well, one of the biggest things that we're very excited about is the Baby Friendly initiative that we have started, and even, I don't have it on my badge, but so we're very proud of our Baby Friendly initiative. This is a hospital-wide and community-wide program that educates people on the importance of bonding and the family for the newborn. We are excited about doing our skin to skin, which is the baby and the mom or the baby and the father almost immediately after birth, and educating colleagues throughout the facility, regardless of your job, as to what it really means to take care of a family and a newborn or a baby. We encourage breastfeeding and to provide support for those mothers that decide that that's best for their child.
That's excellent. That's the best thing for the child, I believe.
Absolutely, and it's a family. It's just more than the mother. It takes the support of the community as well as the family to be able to breastfeed successfully. And so we are very excited about this program, and we are very close to getting that initiative being accredited for being baby friendly.
Okay, great. So tell me, now you've been practicing OBGYN for what?
Gosh, now coming on 17 years, I guess.
Okay.
So it's been great to be in this community for that long, and being able to take care of the patients. Of course, you know, I enjoy obstetrics as well as I do the gynecological side, but educating women about their health and empowering them to be able to make the right decisions for themselves has been exciting. One of my most what I enjoy most is advocacy for women and making sure that we are able to have those opportunities for having decisions in our healthcare.
That's great. So what are some of the challenges that you're seeing in the OBGYN arena, you know, as it relates to women, maybe their communications with you about what's going on in their life when they're, you know, their habits and that sort of thing?
In health overall, communication is key, and being able to, again, it's more than just the patient. A lot of times, it involves the community and the family also. When you're trying to take care of the patient, you really have to understand where they're coming from, their culture, their values, and their lifestyle. And without knowing those things, it's really hard to treat the patient. So surely you can treat an acute event, but if you're really trying to make an impact on health, we have to have a little more understanding about the whole, the patient as a whole.
That makes sense. You don't really think about that, but that does make a lot of sense. So, yeah. So let's talk about sex.
Why do you always want to talk about sex with me, Nicole?
Is that sex sells?
Sex sells, it does.
No, but it's important for
Absolutely.
gynecological health. And, I think sometimes we have conversations with our girlfriends as women or with, other people that we feel comfortable with and not necessarily our doctors. So are there some things that you would want to tell the public about, and women in particular, about, your relationship with your GYN and openness?
Yeah. Well, no one should be embarrassed, especially these days, about their sexual health. And I don't think I have a problem with my patients. They certainly bring their partners to discuss sex with me, and I take that as a privilege that they feel open enough to discuss such a sensitive topic. But I do encourage patients to not set unrealistic expectations about their sexuality, and make sure that if they do have questions, that they are open and honest and able to maybe talk to their provider about them. No OBGYN will ever be embarrassed by it, so you can certainly feel free to talk to them about their questions about sex.
Good deal. So what do you believe what do you believe you want to contribute to the lives of others that, your patients or the people that you interact with on a daily basis?
I would like to bring sustainable change. It is very difficult. We face it every day in our lives, whether we decide to drink that soda, or you decide to have that candy bar, or you decide that you're not going to work out. I would like to help patients, and it's a journey, but to provide sustainable change for their lives. And that would be my ultimate goal, because ultimately, if you're doing good things on a daily basis, that will provide a better quality of life for you. So reducing stress and sustainable change would be what I would like to have an impact on.
We're going to take a break right now. Stay tuned for more conversations. In your opinion, what makes Tallahassee a great place to live, work, and play? Welcome back to Conversations with Nicole. Today's special guest is Dr. Andrea Friall with Tallahassee Memorial Healthcare. So earlier, Dr. Freyal, we were talking about some of the community activities that TMH offers. So tell us a little more about TMH for Life.
Absolutely. When we talked a little bit earlier, I did fail to mention that we also do something called a grocery store tour. So when we partner with organizations, a dietitian can do a grocery store tour with the community, and so that's a pretty interesting activity that patients do learn a lot about how they eat and how to better prepare meals and shop for their families.
I think I saw the mayor doing one where the dietitian was reading the labels in the grocery store so folks could know about calories and the sugars and the sodium and all of that sort of thing, the nutritional values.
It's like a tour, a field trip, but it's an excellent opportunity to learn a little more about shopping. And you want to go on one with me?
Yeah, I would love to. So I know that TMH does health screenings throughout the community with churches and other community organizations, and folks can contact you all about trying to have that take place.
Absolutely. We love partnering with organizations within the community, and we provide that service for free. Yes.
That's great. So in your opinion, what makes Tallahassee a great place to live, work, and play?
Well, I'm a little biased. I did grow up in Orlando. However, my father's originally from Tallahassee, so I grew up coming here for weekends and holidays and thought it was beautiful. Ended up going to college here. But what makes this place unique and special to me is that I loved the opportunity to grow up in a place where we had the impact of the universities, Florida A&M University, Florida State University, and Tallahassee Community College. So you have a diverse and educated population. So I consciously made a choice to come back to raise my family and marry here, as well as having the legislature and being the state capital, what better place to be able to advocate for what not only women's rights but patients' rights here, and having the legislators just arm's length away.
Absolutely. Now, you mentioned the universities. Have you had an opportunity to work with some of the students?
Yes, actually, one of the bright spots about coming back, and one of the things that drove me to come back to Tallahassee also, was the addition of the Florida State College of Medicine. And I have the opportunity to have at least 2 to 3 medical students rotate with me throughout the year. And it's certainly a high point to see that light bulb go on in them as they learn to take care of patients.
Okay. How often do you get to work with the students?
Actually, I get about 2 to 3 students a year for 5 to 6 week increments, and so that's the opportunities that I get to work with the students.
That's great. So as Chief Medical Officer, what impact do you hope to have during your tenure?
One of my goals as being Chief Medical Officer is to continue to engage the physicians and encourage them to bring about best practices within the community to help serve our patients the best way that we can.
Okay. What quality do you admire most in people?
Honesty.
Honesty. Why is that important to you?
I think that honesty and truth are one of the most difficult things that we have to face about ourselves, and it's a journey to be able to face the truth about yourself on a daily basis. And so sometimes we worry a lot about the people around us, and with that, sometimes you are not true to yourself, and there's a balance there. So I truly admire those that have that balance and stay true to themselves.
That's excellent. Is there anything else you'd like to share with us in closing?
I thank you for this opportunity to have this conversation about Tallahassee Memorial Healthcare and our impact in the community. I'm certainly proud to be a part of this organization, and look forward to the wonderful things that we'll be able to do now and in the future.
Well, you are doing a fine job, and you represent TMH well, and I am very proud of you. So thank you for joining me today.
Thank you, Nicole.
Okay. Stay tuned for more conversations. Today's Medical Moment features Dr. Larry Kubiak with Tallahassee Memorial Healthcare. Welcome, Dr. Kubiak.
Thank you. My pleasure to be here.
So today we're talking about mental health, and you are with TMH
Behavioral Health Center, yes.
Okay, and tell me about the center.
Well, we're a 60-bed inpatient psychiatric hospital, so people who need to be hospitalized because they may be a danger to themselves or others or actively psychotic can go into the hospital for a period of time to help get a good sense of what's going on and make sure that they get the most appropriate medication and other kinds of treatment necessary to help deal with their problems.
Okay, excellent. Now, mental health, that's a big topic.
Well, it's a very big topic, and no less an authority than the World Health Organization has said that there is no health without mental health. And certainly we're all concerned about health care and so on, but without mental health, you're not truly healthy.
Right. So mental health encompasses a number of things, depression, bipolarism, anxiety.
Yes.
Tell me about the bipolar piece.
Well, bipolar, there are a lot of variations of bipolar. A true bipolar 1 means that someone has had at least one true major depressive episode in their lifetime and at least one true manic episode. And the severity of the major depression may encompass suicide. And that's really the ticket that gets most people in the hospital. So when you feel so depressed that you want to take your life, then that is something that necessitates being in the hospital to help protect you from yourself and help you get the most appropriate treatment.
Okay.
A manic episode lasts for at least a week and means that someone has problems with sleeping, they may have grandiosity, they may be overly focused on a particular topic, they may be very risk-taking and so on.
So it may be situational.
Well, it could be,
Okay.
but there are certainly conditions that are lifelong, but there are certainly situations that are more situational.
Okay.
For instance, we all experience loss in our life. If a loved one dies, if you lose a job, if a friend moves away, a pet dies, then we'll get depressed. That's part of being a human. But that doesn't necessarily mean that you have mental health problems.
Okay.
So when we get concerned is based on the severity and the intensity. I mean, most of us will bounce back from a depressive episode in a relatively short amount of time. But if it's weeks later and you're not bouncing back, if you're having trouble sleeping, trouble eating, trouble focusing on things, not taking care of your appearance, thinking about hurting yourself, hopelessness, then those are some of the times that it indicate that someone has a more severe problem that needs professional help.
Okay, and do you receive a lot of referrals from a particular place, or?
Well, referrals can come to us through the emergency room, through physicians. If you go to your physician and you're complaining about being very severely depressed or whatever, then the physician might initiate that. Sometimes law enforcement under what we call a Baker Act 52. If a young person breaks up with a boyfriend and talk about suicide, a parent could call law enforcement and they would come and pick you up and initiate an involuntary hospitalization, and you could be taken to the hospital for observation and assessment and treatment under those circumstances.
What role does counseling play in what you do?
Well, counseling is very important. What the research indicates when it comes to treating mental illness is that in many cases, the most effective treatment is a combination of medication and therapy. And one of the things that's been very gratifying during my professional career is that the research has identified more and more evidence-based therapies for a wide range of conditions: major depression, generalized anxiety disorder, post-traumatic stress disorder, and so on. And so the appropriate help is out there. Again, perhaps it may be a combination of medication and therapy, but the help is out there. The challenge is to educate people enough and provide a reasonable access for them to be able to take advantage of that. But there is some excellent help out there.
Okay. And what's the most rewarding thing about what you do?
Well, the most rewarding thing that I do is helping make sure that we provide the best and most accurate diagnosis of what's going on. Because someone might come into the hospital and they're hallucinating. Well, they could be hallucinating for a wide range of situations: schizophrenia, major depression with psychotic features, bipolar disorder, post-traumatic stress disorder, drugs, dementia, and so on. And the therapy is very different. So being able to help the treatment team, our psychiatrists, our social workers, and so on, have the most accurate diagnosis, then the person can get the most appropriate treatment. And that is very gratifying, to help someone get the right kind of help. That is extremely gratifying.
It sounds like it. Thank you for sharing with us today.
Certainly, my pleasure.
Stay tuned for more conversations. We'd like to thank our guests from Tallahassee Memorial Healthcare, Dr. Andrea Friall, VP, Chief Medical Officer and OBGYN, and Dr. Larry Kubiak, a licensed psychologist and Director of Psychological Services at TMH Behavioral Health Center. Join us next week at Centrale Italian Parlor, where we'll be meeting and eating with two women in technology, with guests Ariana Davis and Christy Chapman. I am Nicole Everett. This is Conversations with Nicole, where we are connecting the community through conversations. See you next time. Is there anything else you'd like to share with us in closing?
I'd like for you not to interview me anymore, Nicole.
Well, that's not happening, hon. As long as you continue to be the big dog, you'll be in the hot seat.
I just thought I'd take you off base there. That was funny.
Conversations with Nicole.